Hi guys, Laura here from Sepsis Education, educating healthcare professionals on the dangers of sepsis and its aftermath. So, how is everybody? Hope you're all doing well. I know that it's a really crazy time at the moment, isn't it? Yes, so today I'm going to be talking to you about how sepsis has changed my practice as a podiatrist. And why is that? Basically because having such trauma is terrifying. Before I had the sepsis, I remember having patients with infections and things like that, and you'd be like, right, okay, you need to go to A&E, or you draw around the cellulitis and be like, right, okay, put a time and a date, and then just say, right, you need to go to A&E or the ER, whichever country you're from. And it would just get to the point where it was really blasé. You would be at the point where it would happen so often that it was something that you didn't even think of. And I think it's something in healthcare that some people just have to switch off. But since I've had sepsis, it's completely changed everything. I remember after coming back to work, it was really funny, I had to come back with me paw on my chin because I was still leaking from my chin. One of my friends actually calls it chin continence, which I still find really funny. And it brought up the story of infection to quite a few of my patients. And about 2 months after, I had a person with ascending cellulitis. And I had to draw around the infection and be like, right, you need antibiotics right now. And so I just remember being absolutely terrified for her because it brought back so many memories for me. And it made me realise how we need to be more sympathetic and empathetic when it comes to our patients. We need to be that support. I remember sitting on the dentist's chair after 2 minutes because mine was a form of dental sepsis. It was an abscess below my tongue, something called Ledwig's angina, which makes everything swell. And so because it's an inflammatory response, everything swells. But of course, what's in this area? You windpipe. So it meant that everything around there was like getting smaller and I was finding it hard to breathe. And so with her having this cellulitis, I actually just remember thinking how absolutely terrified I was for her. And so I made sure that I gave her a call like 2 days later to make sure she was okay. And she was coming in 3 days anyway, but it was the fact I just needed to make sure that she was okay. And it made me completely reevaluate everything. And like there was a woman who had just been diagnosed with cancer, and she'd had an operation on her stomach area, and so she couldn't get down to her feet. So of course she had to go and see a podiatrist. And I remember thinking, are you okay? And actually saying, how are you feeling? And for every 6 weeks after this, we were making sure that she was okay because of the chemo and all of these different things. And with the experience that I had when it came to my mental health, I was actually able to talk to her and just actually guide her into things like going to CBT or going different mental health routes, but speaking to her doctor for that information. And it just made me realise that we need to not just see the infection, we need to see our patients. And so please, next time you have somebody with an infection, just take that little bit extra time, because they're going to be scared to death. Okay, thanks guys. As I said before, you've got the bell icon. It would be lovely if you could subscribe. There's going to be different videos every week, and I'll see you soon. Take care guys, bye.